Hello, everyone. Welcome to my APP Insight session today. My name is Tessa Janovsky. I am a PA at Arizona Liver Health in Phoenix, Arizona. Today, we're going to be talking about common questions from primary care providers about MASH. I think one of the biggest questions that I would receive is MASLD the same as NASH? And so why kind of the name change? And so how I would answer that is MASH, or Metabolic Dysfunction Associated Steatohepatitis, replaces NASH to overall better reflect the underlying metabolic drivers, such as obesity, diabetes, and it also removes stigmatizing language. And so the new terminology under MASH umbrella aims to reduce confusion and kind of improve clarity in the diagnosis. And there have been multiple studies that show there is an almost one-to-one overlap of patients who met the criteria for NASH also meet the criteria for MASH. So the terms really can be swapped out without any effect on patient care or ordering labs or anything like that. The next question I routinely will receive is if liver enzymes or liver chemistry, such as the AST and the ALT, are normal, can a patient still have NASH or MASH? And the answer is yes. Many patients with MASH, including those who have significant fibrosis, have normal or only mildly elevated liver enzymes. And so relying solely on liver chemistries can often lead to misdiagnoses. I will also say that in the hepatology world, we categorize normal liver chemistries as in a change in the 20s. And a lot of times the lab values, as far as the normal range, could go up to 55. And so that an ALT of 50 is, to me, still going to show me that there is some active inflammation in the liver. We also receive questions on who should I be looking for? Who should I be screening for MASLD and NASH in the primary care setting? And so all patients with type 2 diabetes should be screened. All patients with obesity or metabolic syndrome, if they have an elevated liver chemistry without any other clear cause, definitely need to be screened. Or if they have hepatic steatosis or fatty liver seen in imaging, even if it's incidental, we want to make sure that we screen those patients. And lastly, what is the best test to screen for fibrosis in clinic? And that's going to be the FIB-4 test. It's easy. It takes 3 different lab values and it's readily available online as far as calculators. And so basically, if you have a FIB-4 greater than 1.3, suggests an elevated risk of more advanced fibrosis and does warrant further evaluation. And lastly, are there any FDA-approved medications for MASH? And the answer is yes. So as of March of 2024, we do have Resmetirom, which is a thyroid hormone receptor beta agonist, has been approved for patients with MASH with fibrosis stages F2 and F3 in conjunction with diet and exercise. And currently, GLP-1s a lot of time are used off-label, but we are waiting for Ozempic to be approved by the FDA for the indication of MASH. So there is more exciting medications in the pipeline for the treatment of MASH. Thank you for listening to this session of APP Insight. My name is Tessa Janovsky. Please reach out to me if you have any questions about MASLD and MASH. Thanks so much.